Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 820 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM, and 1050 AM in Lynchburg, and Wednesdays at 1 PM on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today we're pleased to be joined by Nick Chuquin, who is president of Rivershore Memorial Hospital. He joined for a conversation about rural healthcare, Riverside's evolving drone medication delivery program, and much more. So with that, welcome to the show, Nick. Thanks for being with us.
No, thank you for having me and helping us tell the story on where we are with our drone delivery to some of our patients right now.
Well, we're excited to get into that, but before we do, it's our practice to start the conversations by letting our guests tell a little bit about their unique personal story. Nick, we know that you're president of Riverside Shore Memorial Hospital on Virginia's Eastern Shore. You've held several roles with the health system over the past decade. We also know that you have undergraduate and graduate degrees from Longwood University and VCU, and that you previously worked in higher education as well. Those few details, I'm sure, just scratch the surface of who you are. So beyond that, what should our audience know about you?
So I was born and raised first part of my life in Bogota, Colombia. We moved to the United States my freshman year in high school, and we relocated to the Eastern Shore of Virginia. So being able to continue to work here on the Eastern Shore and be able to lead the efforts that Riverside Shore Memorial is undertaking to provide phenomenal care to our community is really important, and a lot of what drives what I do. I have a passion for rural health care. There's a lot of underserved and marginalized communities, specifically when you look at rural areas across the Commonwealth. So I really try to focus on how do we provide equitable access across the board to our patients. Also on a couple of boards at the local level. I think the one that kind of ties in with this is being on the board of the Virginia Rural Health Association for a couple of years now. I'll be starting my second term in January, and have worked pretty much my entire life in healthcare. Started at FQHC here on the Eastern Shore, worked there for about 18 years, and I'm about to hit my 10 years with Riverside.
Well, we're certainly familiar with the Virginia Rural Health Association, know their work, and sometimes collaborate with them. So that makes perfect sense, and appreciate all your efforts on the shore and to support rural health care. And that actually transitions to the next question, which is about rural health care. So for the benefit of our audience, the Eastern Shore is a 70-mile stretch of land in the Chesapeake Bay. It's largely rural community on a peninsula that's separated by water from mainland Virginia, and it's actually physically connected to Maryland. It's home to 2 counties and about 45,000 people. Several years back, Riverside actually made a significant investment to replace an existing hospital on the shore with a new 2-story facility with a cancer center, a diverse set of service lines, among other resources on the medical campus. That investment is a big deal, particularly at a time when many rural hospitals, of which Virginia has 28, face financial challenges due to a range of issues, including serving older populations with elevated rates of chronic illness and poverty, and greater reliance on government programs like Medicaid and Medicare that don't cover the full cost of care. Other issues include the challenge of recruiting and retaining staff. I know that Riverside Shore Memorial has partnered with local community colleges on clinical career development and has also taken steps to ensure access to maternal care. So, Nick, if you would, tell us about your observations from your experience about rural care delivery and some of the strategies Riverside is pursuing to promote access to needed care to the rural populations and communities it serves.
Yeah, I'd be glad to. I think there are a lot of challenges in providing care in rural communities. You mentioned some of it really with the payer challenges that exist with a lot of Medicare, Medicaid programs, less of your private pay insured patients. And depending on the area, there's an increase in self-pay, which really doesn't add a lot to on the revenue side. So it's going to trying to create a balance to really serve the needs of our community. One of the things that I'm very proud of us and of Riverside, you kind of mentioned maternal health. We are one of, I believe it's 9 remaining rural community hospitals across the Commonwealth that continue to offer obstetric services. And that has become a commitment to our community to ensure that we're going to maintain labor and delivery services on the Eastern Shore for years to come. Looking at that, we're really looking strategically as how can we improve that and how can we make sure we have the right number of physicians to provide coverage, not only on the obstetric side, but on the pediatric side. We're really heavily looking at recruitment in primary care. We just recently started our 4th OBGYN practicing here on the Eastern Shore. That is the highest number of OBs that have practiced at any point in time on the Eastern Shore of Virginia. So that kind of shows our commitment to ensuring care for the continuum of ages across the shore. Over the 10 years that I've been here, we've been able to increase the number of providers within Riverside Medical Group from about 25 10 years ago to roughly a little over 50 providers employed right now on the Eastern Shore providing care to our community. From a mid-share, we've been able to grow the services that we've had, as you mentioned, and have a pretty strong market share, not only on the inpatient side, but on the outpatient side for services, adding services to the community. We're literally days away from completing construction on the addition of a second CT scanner, which has been much needed, not only for access, but really the volumes that we're seeing through the ER and trying to manage the outpatient services. So I think that we feel very confident that we can provide and meet probably 85 to 90% of the needs of the residents of the Eastern Shore right here in their own backyard close to home. When you get to subspecialty care that requires your tertiary type of hospital and specialty services, that's a 10-15% that you really need a much larger, almost academic medical center. But everything else we feel we can do here and do well.
Well, as you said, it sounds like significant investments have been made to make sure that the residents of the Eastern Shore, the communities that Riverside Shore Memorial Hospital serves, have access to the majority of the services they need within proximity of where they live. And whether it's maternal care, and as you said, or other services that folks need, all of those things are critical. And especially in times of emergent medical needs, having that access nearby is so important. We also talked a little bit about care for older residents and noted that in rural communities, the populations tend to trend older. This podcast recently featured Riverside Geriatric Assessment Coordinator Denise Butler to discuss Riverside's Memory Cafe program, which provides a social outlet for people living with dementia and other memory-related conditions. And that Memory Cafe program has recently been expanded to the Eastern Shore. So I wonder, Nick, if you can talk specifically about rural healthcare delivery through the prism of the needs of serving older populations.
Absolutely. And yes, to your point, looking at the population of the Eastern Shore, really focusing on our most current community health needs assessment, it really shows that about 42% of the population is 55 or older. Greater than 25% of our population is greater than 65 years of age. I think when it comes to rural areas and being able to provide the care that is needed for older adults, a lot of the challenges that come into play are understanding and knowing of the community resources, but then also transportation challenges that happen in rural areas. You don't have the benefit of public transportation on a scale that patients can easily get to appointments, get to a pharmacy, get to other ancillary services. So one of the focuses that we have from our community health needs assessment is really focusing on elder and dementia and memory care and trying to build a program or a set of resources to help not only patients, but caregivers. Earlier this year with our physical therapy department, we brought back our Parkinson's support group, which kind of went away during COVID, and then trying to get the right resources to bring it back up. We're able to bring that up, and that is when those patients with Parkinson's and their caregivers can come in and meet with others and work on what are things that are helping ones that maybe can help the others. That also led to the memory cafes and partnering with other organizations here on the Eastern Shore to really get those subject matter experts together and train some of our Riverside team members to facilitate the memory cafes and be able to provide resources, but also a place where caregivers can share experiences and positive experiences with other resources that we've had and try to connect them all to all the resources up and down the shore. Tied to that, we also had a Fearless Caregiver Conference that kind of kicked this off a couple months ago. That was very well attended by the community, and that was kind of like step one. And now with the establishment of the memory cafes that we're hoping to continue to hold quarterly up and down the shore, I think will help to provide a lot of guidance and support to patients and their caregivers with memory concerns and challenges.
On the subject of serving older populations, you mentioned one of the challenges being, in some cases, lack of access to reliable transportation because more remote or rural or smaller communities may not have public transportation. And that really helps us segue to our primary topic today, which is the Elevating Healthcare Access Initiative, which is a partnership involving Riverside, the Virginia Institute for Space Flight and Autonomy at ODU, Drone Up, and the Accomack Northampton Planning District Commission. Through this program, drones are being used to transport vital medications to patients in hard-to-reach communities on the Eastern Shore, and that can benefit people who have mobility issues or difficulty leaving home, or, as we just mentioned, transportation access issues. So, Nick, if you would, tell us about this program, how it works, and how it's being received by the local community.
Absolutely. So the program kind of started as kind of a meeting, I think as part of Go Virginia on Region 5, and kind of looking at, can drones be applied to a healthcare setting? Sally Hartman, who works at our corporate office, reached out to me with that kind of question, and the first thing that came to mind was Tangier Island. Tangier is in the middle of the Chesapeake Bay. We have patients on the island that sometimes have delays of 3 to 6 days for them to get their medication. Going back to discussing our community health needs assessment from 2 years ago and then the one from 5 years ago, transportation, again, is an issue. Patients have difficulty getting to the grocery store, getting to a doctor's office, getting to a pharmacy to pick up their medications. So this allowed us to kind of form a team with some initial investment from the Virginia Innovation Partnership Corporation to start looking at, can we safely deliver medication and medical supplies to patients' homes by drone. As we started the project, USDOT sent out an RFP for SMART grants, with strengthening mobility and revolutionizing transportation. And we were already a couple steps ahead of others in the process. So we applied and we were selected, the only application from the Commonwealth of one of probably 56 that were selected out of close to 260 applicants. And we received almost $1.9 million to prove a proof of concept. So what we've been working on in the last 18 months is being able to safely prove that we can use drones with the partnership that you mentioned to deliver medications first to patients within 2 miles of the hospital. That is what the FAA currently allows for drones to be able to deliver. We successfully retired those risks and have been delivering to 5 patients now, ongoing for a while. We have done a lot of test flights out to 5 miles to show that it is safe to go to 5 miles. And then kind of the home run for us was Tangier and being able to deliver medical supplies to Tangier Island and bring back lab samples to the hospital to run those labs. That is going to drastically reduce the amount of time that patients on the island have to wait to receive medications, medical supplies, but also from a lab standpoint. Right now, they have a lot of point of care in the practice, but if Inez, who's the physician assistant on the island, orders higher level blood work, they have to either find a way to come to the mainland to have it drawn, or they have to wait for Dr. Bice, who's one of our primary care physicians on the shore, to fly over to Tangier twice a month and then bring those lab samples back. So once we're able to really implement this program, we should be able to do that on a daily or almost weekly basis. So that's kind of what got us to now. And we're hoping We've applied for phase 2 of the grant, which closed a couple months ago, and we're hoping to hear in January the results so that we can fully expand and move from proof of concept to actually operationalizing this.
Well, it sounds like really impressive progress and obviously important work. You mentioned that some of this is contingent upon receipt of a future grant award for the next planned phase of this. If those funds come through, what does the future of the program look like? Obviously, you talked about extending the length of the flights that the drones can travel, but what does the future potentially look like, and where does it go from here?
I'll start with the future will be very exciting as to what we can accomplish on the Eastern Shore. And one of the bigger pieces is part of what we're working on is making sure we can create, whether it's a playbook or a plan, so that other rural communities across the Commonwealth and across the United States can implement the same program to help other rural communities in their areas. Switching to when we received this grant, just being very, very hopeful and very positive on the work that we've done and everything that we've been able to accomplish within 18 months will allow us to actually operationalize our process and create, probably over the next 3 to 4 years, 3 to 4 more hubs up and down the Eastern Shore. So you mentioned 75 miles long. So if we're able to put a hub about every 20 miles and be able to deliver in that 5-mile range, we can almost cover the entire Eastern Shore with medication delivery. Of course, it'll take time, but we will start working on day one pretty much on a process for enrollment, a lot more outreach, a lot more mapping of routes and delivery methods to households within that 2 and then 5-mile range. As I mentioned, transportation being a challenge, we know that the hypertensive rate on the Eastern Shore is much, much higher than the average across the Commonwealth. Same with our diabetic rate. And that also ties to congestive heart failure with your hypertensive. It drives a higher stroke risk. So if we're able to really focus on medication adherence, which I talk about different than compliance. Medication compliance is more, do you have the medicine, but you're not taking it. Adherence is really, do you have the ability to get to the pharmacy and then to take your medication? So if we can help with adherence and making sure that our patients have the vital hypertensive medications that they need, we can actually, over time, lower that average blood pressure of our patients, reduce ER visits, reduce hospitalizations, reduce stroke risk level on our patients, and overall improve their health. By expanding this, we're thinking that over looking at the data that ODU and DroneUp have really pulled, looking at transportation issues, number of households that do not have a vehicle, how far out these households are from the main Route 13, which is pretty much the only access to public transportation. And by scaling up and looking at partnership with other members in the community, we strongly feel that by 2030, we could scale to greater than 200,000 deliveries a year up and down the Eastern Shore. But it'll take time. There's a lot of steps that have to take place in order to go from the current hospital pod and then increase the volume and deliveries here to then opening another one and then another one and then possibly a fourth one closer to that year 3.
Well, as you said, it sounds like a lot of groundwork has been laid, and obviously positive thinking, there's real power in that. So I want to co-sign on what you said, and let's anticipate that grant funding will be approved and that this project will continue. It sounds like you've got a lot of really bright plans for the future, and that's encouraging for service to folks on the Eastern Shore who may have challenges getting access to care because of mobility or transportation issues. So appreciate you giving us an overview on that. Nick, we are just about done with the conversation, but before we let you go, we do have a tradition here on the podcast to close things out by asking our guests a pair of surprise questions. To keep things interesting, we have a list of 10 mystery questions. So if you would pick 2 numbers between 1 and 10, I will ask you the corresponding questions.
Let's go with number 3.
Okay, number 3. What's the best piece of advice you've ever received, and why does it stick with you?
That's a really good question. You know what? It's really from a former mentor, and it's something that it just rings a bell because it's something my dad used to always focus on, is being honest and transparent with your team and with expectations. That really drives a lot of the way I work with my team. I lead our team here at Riverside, but it's a lot of the way that I just function as a person. I really believe in honesty and transparency is the right way to go in communicating with others.
As they say, honesty is the policy. Makes sense to me. And then if you want to pick one more number, Nick.
Let's go with number 8.
Number 8 is tell me one memory from your life that whenever you think of it, it makes you smile.
There's a lot of them. You know what? Honestly, the one that always comes back is thinking about my wedding day. When Crystal and I got married, very hot summer day, but it was the beginning of a very happy journey. So I think that's probably what more often brings a smile to my face.
Absolutely. I can certainly relate to that. Well, Nick, I want to thank you for spending some time and chatting with us and telling us about all the great things that are happening with Riverside as a whole, and specifically at Riverside Shore Memorial Hospital and with the drone delivery program, which is growing, evolving, and flourishing with some really promising future prospects on the horizon. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Nick Chuquin, for joining us today. So thank you.
Thank you for having me, and if all goes well, look forward to bringing another update in a couple of years as to the progress that we made on the Eastern Shore.